Hey, I'm Allison Lindstrom, and this is my presentation on the psychological explanations of crime. Starting with the history, both behavioral and cognitive factors are involved in criminal behavior, including what researchers have dubbed both mens rea, a guilty mind, as well as actus reus, choosing to commit the crime. While popular media often portrays criminals as quote-unquote sick individuals who are motivated to commit crimes by an underlying cognitive drive, nevertheless, according to specialists like James Pritchard, Henry Maudsley, and Isaac Ray, in certain cases, criminal behavior can be explained by these cognitive processes. Historically, the phenomena of crime was initially explained by Freudian theory, in which the id, unconscious desire, superego, a drive to conform to convention, and the ego, a mediator between the two, influence both conscious and unconscious thought. This theory corresponds with a psychoanalytic approach, in which the ways individuals deal with guilt can influence their behavior. It proposes that individuals can manage guilt by sublimation, in which id drives are expressed by socially conventional means. It also suggests that those who deal with guilt through repression, in which one denies the id drives, results in abnormal behavior. Following this theory as it applies to criminal behavior, one may argue that, quote, one outcome of the unconscious guilt complex is crime. The policy implications of this theory are that offenders may not be responsible for their behaviors, and it stresses treatment over incarceration. The limitations of this theory are its blatant lack of testability, as it provides a theoretical model of explaining crime. This theory brings the discussion into the greater history of the treatment of criminals as a whole, influenced by the process of deinstitutionalization. This refers to the gradual decline of psychiatric hospitals and the movement of individuals with mental illnesses into prisons as a result. While psychoanalytic theory would argue pure treatment over incarceration for serious offenders, there are alternative psychological explanations for crime with more realistic policy implications. These include attachment theory and frustration regression theory. Attachment theory suggests that individuals without relatively secure relationships with caregivers in childhood have difficulty forming empathetic abilities and understanding the consequences of their actions towards others. Frustration regression theory proposes that those who commit crimes do so due to natural frustration that cannot find a conventionally accepted release or outlet for their frustration. Moving on to trait-based personalities, which will be covered later in the mental illness part of the presentation, a quick overview of the policy limitations include early detection of criminals through extensive profiling, and the limitations are that it does not account for outside factors like environmental influences or social impacts. The behavioral learning theory addresses some of these limits. It takes into account the notion that crime can be explained by conditioning and reinforcement in childhood. A classical conditioning model would suggest that in the presence of a stimuli, an individual reacts to these stimuli in a consistent way until it forms a consistent behavior. Operant conditioning proposes that behavior can be governed through the control of stimuli. Both of these theories rely on the idea that a behavior is strengthened through negative reinforcement, avoiding an unwanted stimuli, and positive reinforcement, which is attempting to gain a desirable reward. Through the lens of crime, if criminal behavior is positively reinforced by benefits outweighing the consequences of the crime, it may be repeated to gain the same effect. The social learning and modeling theory claims that individuals learn to adopt criminal behavior by watching others around them engage in these actions or begin to mimic a pattern of criminal behavior they perceive around them, influenced by potential rewards. Cognitive theory suggests how people think influences their behaviors and the way they feel about their life. Exaggerated thought patterns can lead to intense behaviors such as harsh crimes, and social cognitive theories say that the amount of control one feels they have over life impacts the way they behave. While these theories have some support, they infer that policy should be shaped towards measuring individual self-esteem and its role in crime. The ecological and community perspectives broaden the comprehensive view of the psychological explanations of crime. Ecological view stating the environmental factors influence criminal behavior, and community view noting the importance of social systems. Now moving on to the role of mental illness in crime. So, for and against explanations. So, starting with Gyasi et al., the public perception of psychiatric patients as dangerous individuals is often rooted in the portrayal of criminals in the media as quote-unquote crazy individuals. A large body of data suggests otherwise. People with mental illness are more likely to be a victim of violent crime than the perpetrator. However, by this same source, Gyasi goes on to note individuals with severe mental illnesses that fall through the cracks for one or another reason are non-adherent to treatment and are particularly at higher risk of committing grave acts of violence. So while many people with mental illness be at a higher risk for being the victim of a crime, others with specific illnesses are more likely to be the perpetrators. 64% of jailed individuals report mental health issues, and one-third of the US prison populations are diagnosed with a mental illness. Mental illnesses may be used as an explanation of crime in particular situations, especially when it refers to serious disorders. In fact, according to DeAngelis of the American Psychological Association, quote, people with serious mental illnesses such as severe bipolar or schizophrenia are somewhat more likely to commit acts of violence. In turn, certain behaviors associated with the symptoms of specific disorders can lead to criminal actions under the right circumstances. Two nuances of this include grandiosity and a category of antisocial traits. Specific symptoms of certain illnesses, such as delusions and hallucinations and psychotic disorders, can lead individuals to enact deviant behavior due to unrealistic views of reality. This can go hand in hand with grandiosity, which is one specific trait of serious psychotic disorders. The American Psychological Association notes that people can be overtaken by an exaggerated sense of their own powers, which can lead them to exploit other people. Lastly, a fourth nuance of mental illness as an explanation plays into trait-related theories. In the phenomena of antisocial traits, some individuals that display trait characteristics of antisocial personality disorder may be at a higher risk of committing violent crimes. Quote, violence among people with serious mental illnesses can go hand in hand with a history of conduct disorder and a diagnosis of antisocial personality disorder. In all, certain aspects of mental illness, such as symptoms associated with serious disorders, trait disorders, can influence one's likelihood of committing a crime. Nevertheless, it's important to note that while these symptoms and behaviors associated with certain mental illnesses may correlate to some criminal behavior, this does not imply that it can act as an explanation of the causation of criminality. Environment, risk factors involved in both mental illness and crime, as well as the media representation of mentally ill individuals, all play a role in why it may appear as though mental illness correlates with crime. In terms of the environment, mental illness often correlates with harsh upbringing, which, as previously explained by the social modeling theory, can suggest that these same individuals likely learn to commit crimes from others around them, rather than as a result of their mental illness. Another correlated risk factor is substance abuse, in which mental illness's correlation with drug abuse can explain how altered thinking, while under the influence of substances, can alter one's behavior and cognitive processes, which can propel them to potentially deviant behavior. Media representation also creates a stigma around serious mental illnesses, as these disorders are consistently depicted in popular media as a causation for violent behavior. Common risk factors overall can make it difficult to differentiate for the factors involved in the development of mental illness and the development of criminal behavior. Going back to the previous topic of deinstitutionalization, it's important to note that with a decline in psychiatric hospitals, individuals deemed, quote, unstable by others in their community were often corralled into prisons. This connects to the psychoanalytic theory, which proposes treatment over incarcerations of these individuals. And going back to the evidence for and against, we have serious disorders, symptoms of disorders, and trait disorders, which can all be used as minor explanations for certain criminal behaviors. But we also have evidence against mental illness as an explanation for crime, because it's hard to differentiate between the stigmas, reality, the common risk factors, which can act as confounding variables, and correlation versus causation of how it really correlates with the criminal behavior itself. Focusing on one particular disorder that most closely aligns with a potential explanation of serious violent behavior is antisocial personality disorder. According to trait-based personality theories, abnormal behavior is the result of certain characteristics of personality. The primary set of traits associated with this theory is antisocial personality disorder, which according to Dr. Black from the Canadian Journal of Psychiatry is defined by a pattern of socially irresponsible, exploitative, and guiltless behavior, manipulation of others for personal gain, deception of others, and failure to develop stable interpersonal relationships. However, the main question of this argument is, can mental illness truly explain crime? In conclusion, while mental illnesses correlate with certain crimes and behaviors, it can in no way be used as the sole explanation for criminal behavior, especially considering research support for the notion that individuals with mental illnesses are more likely to be victimized by crimes rather than offenders. So in summary, we have early psychoanalytic theories point to repression and projection for the explanations of crime. In deinstitutionalization, with the decline in psychiatric hospitals, prisons are filled with mentally ill offenders. In current theories, these point to a mix of psychological and environmental explanations, as psychological explanations cannot explain all criminal behaviors. And then I have citations. Thank you.